Good morning, judges and fellow researchers. We are Team Invenio, and today we are not just presenting data. Today, we are presenting a blueprint for Malaysia's future. Our study, the Human Capital Nexus, explores the critical intersection between SDG 3, the good health and well-being, and also SDG 4, quality educations. We are believe that a nation's strength isn't measured just by its economy, but by the health and knowledge of its people. To understand our vision, we must define our plan, or should I say, our two pillars. First, SDG 3. This is about health resilience. It's a guarantee that every Malaysian, from a mother in the rural village to a student in the city, has access to life-saving care and a life free from preventable disease. Second, SDG 4. This is quality education. It goes beyond just by sitting in a classroom. It's about ensuring inclusive, equitable learning that prepares our youth for the challenges of 2030. In this presentation, we will prove that these are not two separate silos. You cannot have a quality education if you are too sick to attend class, and you absolutely cannot maintain a good health if you don't have the literacy to understand your own body. So, let's move on to our next slide. Our analysis narrows down to the most urgent battlegrounds in Malaysia today. In health, we are looking at the success of maternal health versus the rising time bomb of non-communicable disease like diabetes. In education, we celebrate our high completion rates, but we challenge the growing skills gap and the lack of functional health literacy. The goals of these presentations, we want you to see the nexus, and we are here to show you that Malaysia's 98.7% school enrollment is a hollow victory if our graduates lack the health literacy to survive the NCD crisis. We are here to bridge that gap. Now, to show you the pulse of our nation's health, I'll hand it over to our health analyst, Yagesvari.
Okay, the bar chart target on 3C measures the size of health workforce per thousand people. Okay, the regional disparities, for example, the chart compares states like Perak, Kelantan, Selangor, and Pahang. As for the key observation, while Malaysia as a whole has reached national targets for doctor density, significant gaps remain between states. For instance, Selangor, the tallest green bar, typically shows higher density due to its concentrated urban healthcare infrastructure compared to more rural states like Kelantan. A higher density of skilled health workers, such as physicians, nurses, and midwives, is directly linked to better coverage for essential services like skilled birth attendants and also immunizations. As for the index for communicable disease trend, this line graph as target in 3.3 tracks the index of infectious disease over time from roughly 2013 to 2023. As we analyze the trend, the downward sloping line indicates a positive general trend in reducing the prevalences of major communicable disease. Malaysia has successfully maintained low rates for several major targets, including malaria and HIV. However, challenges persist with tuberculosis, which is TB, which remains a significant concern for the country's SDG 3 progress. COVID-19 impacts the timeline indicates and also includes the pandemic years, which globally reversed progress in communicable disease control by disrupting routine vaccinations and treatment services. In summary, maternal and child health, reducing mortality ratios, and non-communicable disease, which is NCDs, addressing rising rates of obesity and cardiovascular issues, which are serious concerns in Malaysia right now. And as for UHC, universal health coverage, ensuring equitable access to quality healthcare for all regardless of states. The first issue here is critical issue, which is non-communicable disease, NCDs. NCDs, also known as chronic diseases, are medical conditions that are not passed from person to person. Leading cause of death. In Malaysia, NCDs account for approximately 73% of all death. The primary contributors are cardiovascular disease, example heart disease and stroke, cancers and diabetes. Linked to lifestyle and aging, risks are heavily tied to behavioral factors like unhealthy diet, physical inactivity and tobacco use. Furthermore, as Malaysia's population ages, officially becoming an aging nation in 2021, the prevalence of these conditions naturally increases. As for economic burdens, NCDs place a massive strain on the economy, costing Malaysia an estimated 8.91 billion annually in productivity losses alone. Healthcare costs for the elderly are projected to reach 21 billion by 2040. SDG 3 Policy Evaluation. SDG 3 aims to ensure healthy lives and promote well-being for all at all ages. For example, strong healthcare system, state-level inequality, and underutilized preventive care. Strong healthcare system. Malaysia's public healthcare system is recognized for its comprehensive delivery of basic services, achieving high rates of skilled birth attendance and low maternal and child mortality. As for state-level inequality, despite national success, significant disparities remain between states. Performance in areas like doctor density and specific disease prevalence, example like tuberculosis, varies and requiring localized improvement. Underutilized preventive care. While the system is strong in curative care, preventive public health is underutilized. Recent policies like the 2023 Health White Paper aim to shift the focus from reactive treatment to preventive strategies to manage the rising NCD crisis.
Now, I will shift the discussion from physical health to what we call a mental and digital fitness, which is the core of SDG 4, quality education. There are four key focus areas here. The first one is education completion rates. This ensuring students not only enroll but successfully finish their educations. And the second one is bridging the skills gap. This is aligning what students learn with what industry actually require. The next one is digital infrastructure. This is the access to technology and internet, which is now essential for learning. And lastly, gender equality. This ensuring equal access to education for all. While progress has been made, the real challenge lies in how these factors interact, especially between access and actual skill development. Now, this is the data between school internet access literacy and ICT skills are in percentage. At first glance, the data looks positive. Literacy rates are above 90%, indicating that most students can read and write effectively. However, when we look at ICT skills, there is a noticeable drop. This gap becomes even more significant in rural areas where internet access is lower compared to urban regions. So, despite having strong foundational educations, many students lack the digital competencies needed in today's workforce. This is the key issues, which is we are producing students who are literate but not digitally skilled. In a modern economy driven by technology, this imbalance can limit employability and productivity. Moving on to the critical issues and policy evaluations. The first one is critical issue skills gap. There are three main problems. The first one is high literacy but low ICT proficiency. The next one is a mismatch between education and industry needs. And lastly, this gap directly affects graduate employability. So, from a policy perspective, there are strengths, which is Malaysia has a strong foundations in basic education. However, challenges remain. The digital divide, especially between urban and rural areas, continue to limit equal opportunities. Additionally, there is a need for curriculum modernizations, particularly to integrate digital and technical skills. So overall, the issue is not about education. It is relevant of education in digital economy.
Now, let's move to the core of our research, which is the integrated analysis, where we connect SDG 3 and SDG 4. First, what do we mean by integrated analysis? It refers to combining different perspectives, in this case, health and education, which is to understand how they influence each other instead of studying them separately. The key idea here is simple. We cannot solve health issues without education, and we cannot fully improve education without considering health. These two areas are deeply interconnected. Let's look at the logic. When people have better education, they develop higher health awareness. This leads to smarter lifestyle choices and better decision making. With stronger digital skills, individuals are also more capable of using digital health tools such as MySejahtera. As a result, access to healthcare improves, early detection increases, and ultimately, non-communicable diseases, which is NCD, rates can be reduced. So, the synergy between these two SDGs is very powerful. In fact, one key insight we want to highlight is education is the best preventative medicine. By investing in education, we are not just building knowledge, but we are actively preventing future health problems and strengthening the overall well-being of society.
Now, let's talk about the solutions. To bridge the gaps highlighted by the previous speaker, we are proposing 4 high-impact recommendations aimed at structural reform. First, with the healthcare sector, we must distribute the healthcare workforce. It is not just about having enough doctors, it's about having them when they are needed most, specifically in our rural communities. Parallel to this, we need to promote preventive healthcare programs to reduce the long-term burden in our public facilities. On the digital and educational front, we need to expand rural broadband infrastructure to ensure no student is left behind by the digital device. Finally, we must integrate ICT and health literacy directly into the national education curriculum. By teaching these skills early, we empower the next generation to navigate a digital-first economy and take charge of their own well-being. To wrap up our analysis, let's look at the biggest picture of Malaysia. First, Malaysia shows strong SDG progress. Second, challenges remain in equality and skills. And last, policy innovation is key for 2030 goals. For those interested in the data behind our findings, our analysis was based on a robust framework using the DOS MSDG portal, the Malaysia SDG Hub, and the SDG Malaysia States Dashboard. That's all from us. Thank you for listening.